Hi, everybody. My name is Suzana Marku, nurse practitioner and co-founder of Your Formula.
And I'm Dr. Jonathan Zaidan, again, co-founder of Your Formula. And I'm going to start with, and it's an exciting day, extra, read all about it, because the FDA Advisory Board just gave its approval for 2 new peptides to be formulated by accredited compounding pharmacies. And so you can tell I'm being very, very, very conservative in my wording, because there's an awful lot of different approvals that are given, but that's the best that I can say on this. But the good news is that we can now have reliable, consistent peptide formulations. And so the exciting part is that we got 2 of them today.
Yes.
So one we've already talked about on a different podcast, because we know that, well, quite frankly, we know that everybody gets a little bored. And if we talk for more than 3 or 4 minutes, they don't want to hear about us anymore. But so we've already talked about BPC 157. So if you want to know more about that, there's another podcast. You'll be able to see it. Just click on yourformula.health and you'll find that. But more importantly now, let's talk about KPV. This is something that I'm super excited about, because KPV works for a disease process that I care for a lot in women, endometriosis. And it works in a way that it could be very successful in helping me treat those patients. So the fact that I now have a different tool in my tool bag is, in my mind, one of the most exciting things that happened today.
Yeah.
And maybe in the last 6 months from an endometriosis perspective. But why don't you tell us a little bit more about what that is? Because I think there's some unique things, and if you don't touch on them, I will, about KPV. First of all, tell us what it is.
Yeah. So KPV is actually a tripeptide. Okay. So it's 3 peptides in one, lysine, proline, and valine. And I'm going to go a little bit into kind of how it works and how we can utilize it. So when we think of KPV, it's actually part of a fragmented part of what we'd call a melanocyte-stimulating hormone. So that kind of gives it away to those science buffs out there that it does impact the skin. So obviously, you know that I also am very, involved in female aesthetics and male aesthetics. So I was happy about the
If you want to know what, I'm going to go out there on a limb. It's all about her in the skin.
Yeah, I do love.
Here I talk about endometriosis and this great thing, and we're going to help all these people. And what does it all come to? The skin. Then she starts.
Yeah, I'm going to gravitate towards that first.
No, I love it. This is so great for people. Some people that are taking some of these immune modulators that are, FDA approved right now. There's a lot of side effects for that stuff.
There is.
And so this may be kind of that middle ground that people need. But we'll work on everybody, right? It's not, it's not going to be an overnight cure or anything, but everything that we do is in modulation, safety, reliability, make sure that we have consistency, that we can get it on a regular basis. These are the things that we're about at Your Formula, because we have to give you the right formula for your health. And that's why we called it Your Formula. So tell us a little bit more about these other little items that this KPV can do.
Yes. So when we think about it, right, so again, we talked about its access to improving skin and inflammatory conditions of the skin, but it's also an anti-inflammatory, we always talk about gut health, right? We always talk about inflammation within gut health. So KPV does reduce full body inflammation, which I'm certain is obviously kind of where you were touching point from the endometriosis standpoint.
Correct.
But for patients, I'd say where more of my specialty comes in, or I should say my clinical experience comes in, is this is your patient with very difficult to treat psoriasis, eczema, inflamed cystic acne. This could be a great adjunct service to that.
So exciting for these patients, because, one of the things that I realize is that you just don't know how much somebody's impacted when they have those conditions. It's everything, your skin, your eyes, right? Your face, your teeth, they're your window to the world. That's what people are seeing. And when you don't have that as nicely as you might want, we're all going to look a little different. We're going to have a different skin color, but the one thing that, connotates health in every culture, every skin type, every skin tone is, smooth, healthy looking skin. And if this can help these people, I mean, how crazy it is. And what I like about this, and I think that we should touch base on it, is that a lot of the medications that have been FDA approved, which by the way are very expensive and have a lot of side effects, they're, immune suppressors, right? This works differently. I like this because, and I think this is the stuff that we're going to, over the next 1,000 patients. And I urge people to look. I said this about BP 157. Look back, this date is July 23rd, 2026. A year from now, we will have seen thousands of patients with this because we don't see that many of them today. And so we'll be able to give you a very, very good clinical evaluation of how well this works, because sometimes what you hear and the reality of it are two different things. But everything that we've heard is so good on the immune modulation component. So we're allowing that immune system to not be so overactive at the level of the skin and at the level of the dermal areas. And we're allowing the skin to kind of heal itself without attacking itself, so to speak. And this is, it really is. I hate to say this term because when we say it, I always feel like we're over speaking it, but it's really kind of groundbreaking because it is the middle ground. You can either go from no immune suppression and having your body kind of just attacking itself, or completely suppress it. The attack goes away, but now you have all the risks of being immune suppressed. And we all know what those are. Everybody knows something about someone who's had chemotherapy drugs or whatever. This is in the middle ground.
Yeah.
And how many patients, I'm going to put you on the hot seat, but, when you see 100 patients, obviously this is way off the cuff. How many patients do you think have like true skin conditions that could use immune modulation?
Oh, obviously there's going to be a variance in like mild, moderate, severe symptoms, but from an anti-inflammatory standpoint and an immunomodulator standpoint, I would say easily 50%. I think we could all, in some way, shape, or form, utilize something within that framework, but easy. Like that's a conservative level.
Well, I actually didn't, to be honest with you, I really didn't think it would be that high. But, you have to remember what I do, right? I see mostly gynecologic, conditions. And then when I see people for compounded hormones, I don't see the skin
you don't see this
practice as much as you do. But the point of the matter is, it doesn't matter. Clearly, as Susie said, there's a lot of people out there that could benefit from this. I think that, we've said what we need to say about KPV. What we need to do is start using it and then, really collect clinical data on it as well. I don't think there's a huge risk for side effects because we're not completely, immune suppressing anybody. And these are natural compounds. Remember, when we're talking about peptides, these are natural compounds. These are not compounds that, are made in the lab that are completely, have never seen the body before. The body knows, what lysine is. It knows what valine is, right? So it's not something that it is unknown to it. So, what I would tell you is that I think this is a really groundbreaking new kind of idea that we can be using to help people. And I think there's a lot of people that are going to want to try it. I think that we're blessed to be able to offer it. Tell me, is there anything else that we got to cover here for KPV?
Not necessarily for the KPV standpoint. And I think a lot of these terms, patients who are watching this podcast or listening in are going to be like, well, yeah, I've heard of these peptides before, but why is today so significant for your formula? And it's so significant because we perform at a level that a lot of other providers do not, a lot of other companies do not. We are a multi-state, legit script certified, PCAB accredited entity. So today is a groundbreaking day because although we knew about KPV and we knew about BPC 157, we could not prescribe it. We could not fulfill it. So now we have those gateways open because now those peptides are going to be included on what we call a 503A bulk compounding list, which means pharmacies like us that do function at the highest level of sterility can now proceed with what we wanted to do.
I think your point is well taken. I mean, I don't think we had as much experience with KPV as we have with BPC 157. I think everybody that's in the peptide world has heard of BPC 157, and I don't think as many have heard about KPV. But what I do think, and what I think is probably going to happen very quickly, is you're going to find that there's a huge need for it. There's been some pent-up demand for sure for BPC 157, but I think you're going to see that there is a lot of patients that when exposed to KPV are going to want to trial it. And that's where I think your formula comes into play. I think our customers and our patients actually provide a service to the other patients because we'll be able to give better statistical data on how these people, how they ultimately repair their skin or how they feel or what their side effect profiles are. We don't expect, we've done our research. We don't expect severe side effects in any way, shape, or form, but we'll see all those little nuances that we might want to tell somebody. I mean, skin protections when they're taking it, so on and so forth, what's needed, what really happens with different skin types. That's the type of stuff that when an FDA, gives an approval for people to start compounding these types of medications, we start to get more volume, and that volume allows us to get more data. And I think, come back to see us in a year. Again, July 23rd, 2026, KPV. We've learned a lot. This is another tool in the tool belt to get to the right formula for you, your formula. Susie, anything you want to say?
No, I love it, and I'm excited, and every day is an amazing day towards better health.
I love it too. We keep making progress. Keep in tune with yourformula.health. There's always something new on there. We're bringing on some exercise things that are going to knock your socks off. It's amazing. Nutritional stuff. Again, everything is there to make a patient better. It's what we want to do. It's what we're doing. Your formula.